Hi, I'm Phil Moeller. I write articles and books about retirement and healthcare, and I've written a lot of pieces about Medicare. When people approach 65 and decide to keep working, they have some important decisions to make about Medicare. I'm going to talk today about the decisions you need to make when you work for a large employer with 20 or more employees. Medicare rules in that situation give you the right to do nothing if you choose. You can just keep your Medicare. But it also sets up a series of possible decisions, and I want to sort of talk about those today. There are really three pathways here. The first one, as I said, is you can keep your employer plan and you don't need to get Medicare. The second approach is you can keep your employer plan and you can also get Medicare. And there's some situations where that makes sense. The third pathway is, well, you can get Medicare and you can drop your employer plan. So these are the three pathways. Let's talk about them in order. So when you decide that you're simply going to do nothing and keep your employer plan, there's one wrinkle I want to make sure you're aware of. Even though your employer is obligated to continue offering you health coverage, including drug coverage, Medicare rules stipulate that your drug coverage in your employer plan has to be at least as good as a typical Medicare Part D plan. If it is, fine, and your employer has to give you a statement that attests to this. People don't know that their statement even exists, let alone they should ask for it, but your employer has a legal obligation to provide this. It's a key piece of paper for you, because if your plan is credible, you're fine, but if your plan's not credible, then you have to get a Part D plan, even though you're going to keep your employer coverage. In that situation, you can get a Part D plan without having to also pay for Part B. All you have to have is Part A, and you get a Part D plan, you keep your employer plan. That's the most significant sort of implication of keeping your employer plan as far as Medicare is concerned. The second situation is you decide, well, I think I want to keep my employer plan, and I also want to get Medicare. In that situation, you really need to pay attention to what is Medicare going to give me or get for me that my employer plan is not going to cover. Historically, people tended to just keep their employer plans and they didn't worry about getting Medicare when they turned 65. However, employer plans have changed a lot in recent years. Many people now have what are called high deductible health plans. You may pay $3,000, $4,000 or even more out of pocket before your employer health coverage starts helping you pay those bills. In that case, it can make a lot of sense to get a Medicare plan which can help pay that deductible for you. Also, Medicare may cover some things that your employer plan doesn't. In particular, a Medicare Advantage plan can cover health clubs and dental, hearing, and also some vision coverage that your employer plan may or may not cover as well. So look at what your employer plan covers, see what you're exposed to in terms of cost and coverage features, and then you may decide that you actually want both. The third thing is you look at your employer plan and you look at what Medicare offers and you say, well, that's pretty expensive to do both of these. Maybe all I need is Medicare, and that's quite possible. You need to understand what Medicare will cover and see what would happen to you if you don't have that employer plan anymore. In that case, you also need to pay attention to what happens to your family. If your spouse and your children are insured on your employer plan, you probably want to think long and hard before you drop that employer plan. Although it's still possible that you and they could be better off if you dropped your employer plan and they went on a state insurance exchange and got their coverage. Those are decisions that you can make. One thing I will say is that you don't want to wait too long to make these decisions, and you also don't want to guess about what's going on, because you can't make an informed decision if you're not informed, to say the least. We've covered lots of ground today, so let's recap a bit. If you work for a large employer with 20 or more employees, the employer must continue offering you health coverage. You have three decisions. You're going to just keep your employer plan, you're going to get Medicare plus your employer plan, or you're going to drop your employer plan and just get Medicare. All of these decisions should be based on information and knowledge about what's covered, what's not, what it costs. That's information that you need to get from your employee benefits department, and you need to get it before you turn 65. Don't dawdle here. You really need to act on a timely basis to make sure you make informed Medicare decisions. If you have any more questions, you can go to MedicareMadeClear.com and get additional information. Thanks so much for spending some time with me.